Hello, welcome to ANA community. From the past several videos, we have discussed the indications of ECG and normal ECG paper and regarding the normal ECG contents. In the particular present video, we are going to discuss about the leads of the electrocardiogram. When you say about the ECG leads, they are nothing but the viewing the heart from the different angles. Some of the occasions we are going to view the heart from the inferior side. That is and so in some of the occasions we are going to see the heart from the anterior side. In this way, we are going to see the heart from the different views, so that any kind of the abnormalities we can able to very clearly identify by seeing the abnormality related to that particular side itself. As far as the ECG leads are concerned, basically 12 leads are being conventionally recorded in the routine electrocardiogram. So as we have discussed earlier, it is nothing but the different views of the heart from the different angles or from the different sides of the human body. Basically, 12 leads are again of two categories: 6 frontal plane leads and 6 horizontal plane leads. 6 frontal plane leads, they are also being termed as the limb leads. So they are, and horizontal plane leads are termed as chest leads. The reason of saying frontal plane leads as limb leads, because here the electrodes are placed on the limbs, whereas the horizontal plane leads, they are also being termed as chest leads, because these leads are being kept over the different locations of the chest. So the 6 frontal plane leads are 3 bipolar leads and 3 unipolar leads. The 3 bipolar leads are lead 1, lead 2 and lead 3, and unipolar leads AVR, AVL and AVF. So here the term A refers to augmentation. So that means whenever you are doing the augmentation, so there will be the slight increase in the amplitude. That means the voltage of the deflection we are going to observe. And here the term V refers to unipolar lead. As far as 6 horizontal plane leads are concerned, they are nothing but the unipolar leads. They are V1, V2, V3, V4, V5 and V6. So these are the 12 conventional leads that are usually being recorded in the electrocardiogram. When you think about the meaning of a lead, it is nothing but a complete closed circuit. That means complete closed electrical circuit. When you think about it, electrocardiograph, it's a positive electrode connecting the human body, and on the other side, the negative electrode will be connected to the negative side of the electrocardiograph and electrocardiograph. That means the whole circle is considered to be a lead. ECG machine, positive electrode connected to the ECG machine and human body. Third factor, that is human body itself. And the next one, the human body connected to the negative electrode, which is being connected to the electrocardiograph. Lastly, the electrocardiograph. So that is nothing but a word meaning of lead. Most of us having a misnomer. Leads are nothing but the wires. No, wires are different from the lead as such. When you think about the routine electrocardiogram, so here the electrode is also being kept on the right lower limb also, right leg. This is not actually recording any kind of the electrocardiographic deflections. This will be acting as a base for the electrical equipment which we are going to use to record the ECG recording. So that is acting as a base. When you think about the lead 1, this is considered to be a bipolar lead, wherein the electrode are being recording the actual electrical potentials between left arm and right arm, wherein the positive electrode will be connected to left arm and negative electrode is being connected to right arm in case of lead 1. As they are having the recording the actual electrical potentials between the two electrodes, they are being termed as bipolar leads. When you think about the lead 2, again, it's a bipolar lead wherein the positive electrode will be connected to left leg and negative electrode will be connected to right arm. When you think about the lead 3, wherein the positive electrode will be connected to left leg and negative electrode will be connected to left arm. When you think about it, all these three are forming the Einthoven's triangle, which we are going to discuss the concept of Einthoven's triangle and its significance in the coming videos. When you think about the AVR, it is nothing but a unipolar lead. So here the positive electrode will be connected to right arm and negative electrode will be connected in such a way that it will be at zero potential. So that means this particular unipolar lead will be actually recording the electrical potential generated that is not considered to be any kind of the difference, potential difference will not be observed on the negative electrode side. That means the center of the heart can be considered here as far as negative electrode is concerned. When you think about the AVL, it's again a unipolar lead wherein the positive electrode will be connected to left arm and negative electrode will be at zero potential. Wherein AVF, wherein the positive electrode will be connected to left leg and negative electrode will be at zero potential. As far as chest leads are concerned, they are also being termed as horizontal plane leads. They are again 6 in number. V1, V2, V3, V4, V5 and V6. So these are the different locations of ECG horizontal plane leads. V1 will be connected to right sternal border, fourth intercostal space. Whereas V2 will be connected to left sternal border, fourth intercostal space. V3 will be connected midway between V2 and V4. Whereas V4 is connected to the fifth intercostal space at the left mid-clavicular line. Whereas V5 is being connected to anterior axillary line on the left in fifth intercostal space. Whereas V6 will be connected to left mid-axillary line in fifth intercostal space. These are the different locations. The purpose of having this particular 12 conventional leads, that is actually helpful in localizing the lesion. Suppose if the person is having the V1 and V2 abnormalities are being observed, then we are going to say that the person may be having the right ventricular abnormality. Suppose if the person is having the 1 and AVL abnormalities, then we are going to say that the person is suffering from, probably, is suffering from left side of the heart affliction. In this way, this 12 conventional leads, that is 6 frontal plane leads and 6 horizontal plane leads, will be helpful in actually localizing the lesion. As far as the conventional leads and view of the heart, wherein 1 and AVL, that is actually representing the left side of the heart, whereas 2, 3 and AVF, that represents the inferior surface of the heart. wherein AVR is actually representing the cavity of the heart. That means wherein the electrical potentials are not usually being recorded. Whereas V1, V2, that is actually representing the right ventricle. V3 and V4 representing the interventricular septum. V5 and V6 representing the left ventricle. Whereas the V1, V2, V3, V4, 1 and AVL that represents anterolateral surface of the heart. So this is what is considered to be the overall viewpoints on the conventional leads of electrocardiogram. The take-home messages from today's discussion are basically 12 conventional leads are being used to record the ECG recording. Among them, 6 are considered to be frontal plane leads or limb leads. They are 1, 2, and 3, and AVR, AVL, and AVF. Whereas 6 horizontal plane leads or chest leads are V1, V2, V3, V4, V5, and V6. All these the 12 leads are helpful in localizing the lesion of the heart. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.